So come lay down here, and then I'm going to put you on your side with your head faced out that way. And your right side's up. Is that going to work for you? Here you go. So can you scoot forward for me just a little bit? There we go. So the reason we're going to repeat something we did yesterday is I just want to go into this real quick to open her up so we can build up to this. And this motion, like all this down here and then back, does that feel good to you? Yeah. It's all of this, you're on my leg again, like that. And then there was jostling the shoulder blade and opening this up. All feels good? Mm-hmm. You generally like twisting back?
Yeah, I like that.
And then is it just because it's opening the pec and pec minor, like opening the chest?
Yeah. Anything where I'm doing that.
So I did that very quickly just to open it up, just because I want to not go in completely cold. I'm going to stand up, holding her arm. I'm going to slide this shoe off, and I'm going to anchor her here at the sacrum. How is this right here?
Let me fall into it. Yeah.
So if I don't like pulling here across the wrist, I can always bend at the elbow and hook into the forearm extensors while I pull there. Sometimes I'll shake people out while I do that. I'm going to slowly bring her back into position, meaning lifting her head back. There we go. And then I'm going to place my foot. The ball pad of my foot is along the erectors on her right side, but I'm going to slowly jostle her with my foot. I'm trying to feel the erectors there. If you had a choice, do you want pressure here or do you want a little higher?
I like it a little lower.
A little lower, right here?
Right there.
Okay.
Perfect.
So I'm gonna gently roll her into my erectors, hold that spot. How's this right here?
I'm feeling that a lot on my arm.
Too much? Okay. What if I pull you down this way?
Yeah.
Still a lot in the arm?
Not as much, no.
Not as much? Okay. So am I working on her back? Or am I working on her pecs and her chest?
Probably a little bit.
Yeah, it's a little bit of both. And it depends
Just
on...
that is really good.
Once you toggle from like multiple points of contact, you can sometimes be doing 2 or 3 different things. I'm going to slowly, again, bring her just up and forward a little bit. I'm going to work my foot right along her shoulder blade. I want to see right in, how's that there?
Mm-hmm.
Okay. Is that too much on your spine?
Oh.
No? Okay. I'm going to bring her arm down to her side. I'm going to see, how's that right there?
Oh, yes.
Okay. So her shoulder blade so far feels like it's a little tight, like it's kind of on her rib cage. It's not wanting to slide over my toes. I'm just inviting that open. When I put her arm down by the side, it takes the shoulder out. What it allows me to do is use this as a handle to roll her. I'm just curling my toes in. How's that right there?
Mm-hmm.
And in her case, I'm going to change this. I'm going to see if I put her arm behind her back, does her shoulder blade? It does. Yes.
Yeah.
How's that right there?
Oh my.
There we
That's awesome.
Are you feeling that in the front too?
So
you
my
feel that
work-
in the front also? She's like, I don't hear it.
What? Okay.
Oh, breathing. Do you feel it in the front also? Do you feel it in your back?
Yeah, I'm feeling it mostly right in that kind of between deltoid and pec. Coming in.
Too much?
Mm-hmm.
There. How's this? How's that?
No less. Yeah. Like right where you were, just not any further.
Too much? Now, I'm still pressing into the rhomboids. I'm pressing into the paraspinals. My toes are reinforced, but they're not really digging. I'm mostly pulling her into me. I'm receiving the client. This is also opening her chest. If I don't like the arm portion, I can always put her arm down back at her side and just do this piece. How was that?
Wow.
I had one foot on the floor. Misogyny cannot fire me for doing that, at least to my knowledge. Well, then they probably could fire me, but you know what I mean. They couldn't fire me for that specifically. You guys want to try that? I want you to try at the sacrum just to get that full kind of long twist. I want you to play with the ball pad of the foot along the erectors, and then see if you can gently work your toes up around the shoulder blades.
Face this way so I can see what you're doing since I missed the first little part. That's okay.
Open.
This one already.
I felt it just
Hang on.
so
Because they totally come down to ours, and I've actually worked with two of the people that come to
That's
the
okay.
gym.
It feels way better. Thank you.
Phenomenal. She's like from Thailand to the one. I saw her during her hours and stuff. She's great. She just graduated, so she might even be licensed now at this point. Yeah, she's fantastic. Yeah.
So we did that big, robust opening of the chest. I didn't do that yesterday because I didn't want to just keep harping on sideline like the whole time. I teach a single-day table-based class in Dallas periodically, like once every 3 months or so. And that was the first time I really started to tune into the fact that most therapists don't work in sideline. A student would comment like, dude, is this whole class sideline? And the reason I kept showing them sideline is because they had an entire primary position on the table they weren't using. They would never put the client in sideline unless they were pregnant. But what I think is that sideline is devastating for upper back and neck work. It's my go-to 9 times out of 10. Anytime I had a table-based client at the chiropractor's office, lay on your side. What? Trust me. I've been doing this for 14 years or however long it had been. Being able to work with them this way gave me a whole lot of advantages and a whole lot of new options. We did that big, robust opening. You still have some issues, like you like to work in the pecs? Mm-hmm. Okay. So I brought a towel with me this time in case I need it. I'm going to take her and roll her open. I'm going to see how I'm going to manage this. I'm back in. I'm going to roll her open. How's this right here?
Okay.
Good. Okay. Here's my handy dandy towel because I want women to feel comfortable when they're working with me. So now, how's this in here?
That's tight.
Okay.
But
so
that's
right
not, that's not uncomfortable.
Not uncomfortable? Okay. How's this?
Wonderful.
Nice. Now, ladies, I want you to be aware of this. There's nothing wrong with this. You're going to work on a guy and he's going to do this. Right? Yeah, I know. I know. I hear stories. I work with women. I don't know why guys are like that. Just be aware of it. This might not be appropriate for all clients. This is certainly more intimate. How's this?
Well, now you have me worried that my hand's gonna go.
So no, and the thing is, I'm so used to passive body contact. I don't have any problem if the client, embraces me for a second or whatever, just because they're moving or, lost in their sense of space. It's when there's untoward notions with it that it becomes problematic. I just say this because we're also not used to passive body contact, and I don't want you to give your clients the wrong idea because they don't have context. Does that make sense? Mm-hmm. So now the pecs here are completely open to me. Is this too much?
No.
Okay. I can work very, very close to breast tissue. The great thing about sideline is breast tissue falls forward. You'll notice that I called it breast tissue. It sounds clinical that way. Women are much more akin to being able to feel safe and comfortable when you use that sort of a little bit, just slightly clinical language. Now, when I come in and work right here, is this too sharp?
A little bit.
It's a little too sharp?
liked the really broad.
The knee.
Was that your knee? What?
Well, earlier when I got up
yeah,
and did the
yeah,
demo,
yeah.
it wasn't on you, was it? It was on somebody else.
No.
Right
Yeah,
here.
that's
Okay,
what I liked.
so here's the thing. This is what I did. Instead of using the point, I shifted to using this. And I was trying to communicate with her on what I had used because I'm changing position so rapidly, I don't know what I did.
Mhm.
But if I hook in right here,
Yeah. Yeah, that's great.
and how's the jostle? Is it too much on the shoulder joint?
No.
Okay, because I could lift this leg.
Uh-huh. I think
Now, I just got
the
fired
shearing.
from misogyny
Yeah.
for this.
Yeah.
Right there.
Yeah, that's awesome.
Now, down
Mhm.
or up?
Down.
More down? Okay. Now, more to the midline or more lateral?
Lateral.
Right there. How's that?
Yes, that's exactly what I wanted.
Then I'm going to slowly take this out. I'm just going to throw a couple of options at you, okay? Because I can still work like the bicep from here if I don't give it too much in the shoulder joint, right? I could also cushion here. I can also lift her up and get into serratus. How's this?
Yeah.
Oh, and I actually scooted in to like stack her forward because she was rolling back because of what we were doing before. How's that? A lot of people who are having problems, I had an issue with this. Danielle Omo showed me this. I'll give her credit on camera. I was having problems with my left side and shoulder, and my serratus was hiding because it was in the side. Because it's easier to work on the front of the back. I can lay on a foam roller, but I started rolling onto my side because of Danielle. She was working in here, and I realized some of my shoulder pain was actually coming from serratus, pulling my shoulder blade forward. We worked on pecs. We worked on pec minor. Serratus is often tight and pulling people forward as well. Right there. Now up or down?
Down. Yeah.
Right there. Now a little more forward or back?
I think back, yeah.
A little bit back, right there. How's that?
Mm-hmm.
You like the jostle?
I can't tell
Or
which I
static.
prefer. I like both of them.
Okay. So very slowly, without hitting me, can you lift your elbow? Start to move your arm. And you can move that any direction you want, if it helps.
Mm-hmm. Right there.
Right there. There we go. Now, I'm going to hold right here. Can you give this to me?
Mm-hmm.
There we go. How's this?
Ah, yeah.
Lots of options once you start playing with multiple points of contact. How's the jostle through there?
Mm-hmm.
Okay, because now I'm going to change it. And now, rotator cuff. Oh, everybody loves infraspinatus. Everybody loves this. Now, I'm going to use flat knuckles. I could be mean. This is a really great way to jostle this open. This is very much just flat knuckles. Now I can start to angle towards sharp, but I'm going to start broad and just jostle this out. If I feel like they're holding, hey, look familiar? There's sort of like a primary position, and then there's all these secondary and tertiary options from that. From this position, I can work on the pec, I can work on the serratus and more like the axillary border, and then I can work on the rotator cuff right here. So how's that, right?
Yeah.
Oh.
Yeah.
That's right at the border of infraspinatus. How's that?
Yeah.
Wow.
Yeah. That's.
And this is just to wake this up. We're massage therapists. We're using the rotator cuff constantly to stabilize the head of the humerus while we're gliding down people's like lamina groove with our forearm and elbow. This is a really, really great position. I just wanted to throw a couple extra pieces. Do you guys want to try those?
Yes.
Yeah.
Thank you.
Oh, you're welcome. Thank you for letting me demo. Oh, and somebody can use this if you need it. I definitely think when you're learning how to use the elbow there, try to be broad. Maybe cushion it with a rotator.
Yes, it was so beautiful.
I was new to CLS, so which way am I going? All right.
And you always forget, like, I'm right there with. Do you want the headrest?
I'm good.
No.
Because people like me were coming in and like eating their lunch like working in private practice because I was marketing this kind of niche service. I keep trying to encourage the facilities to go further and start offering mat work, and they go, hold on, hippie, like this is, you know, I mean, we know you do things in your place, but come on now, let's get real. I think the industry in the next 10 years, I talked about massage envy, I think the industry is going mat-based. I see it, that the work is too effective, it's too easy on the therapist, and I think because it's clothed, it's a huge advantage to be able to market, promote, sell, you know, show off, right? Do you guys want to do a little bit of footwork? And you were asking about feet. Do you need to work on your feet? Or do you want to watch? So let me put the... So I was going to put the face rest down. I think what I'm going to do is have you lay down on your front, and I'm going to put this towel down. And you can just turn your head to the side. There you go. Is that going to be comfortable for you for that? Okay. So when I work on people's feet, and I'm sure you've seen, you know, you come in and do this. Do you ever like sit in a chair or sit on the table and do this? Okay, what about this? Now, I need to make sure they have enough ankle mobility to be able to stand this, and I'll also ask them, I need you to tell me verbally if it's too much pressure, okay?
Okay, I'm
Yeah.
comfortable with
How
it.
does that feel now?
It's comfortable.
Good. If I've done one, I can probably do the other.
That rotates it.
A little bit. For some people, their ankles are going to be really tight. You'll have to maybe roll them in so you have a little more flat surface area. The other thing I'll do is once I've hooked up into here, I'll come up into the calves. Tell Massage Envy I still have 1 foot on the floor. Okay. Is that too much pressure there?
Not at all.
Okay. And then when I'm, being, I guess, more creative, some people would say more lazy. It just depends on how I feel and what I want to do. I'm going to guide this leg out just a little bit. I'm going to come in and hook her foot over my thigh. How's this?
Nice.
Much sharper.
Mm-hmm.
How's that?
Very good.
I've got all these additional options. If I want to stretch the foot, I can, stop off and start using my fingers if I want. But usually I'm trying to use my fingers, hands in a minimal way. How's that?
Good.
How's this?
That feels good to it.
Tons of options, right? Do you guys do this one? Cool. So this one wasn't that new. Now, would I come up like this and actually just get on the table with both knees?
Is that okay on your toe?
Yeah, that's better.
Is that better there?
Yes.
There we go. And it's just because of that big toe?
Yes.
Yeah. I didn't know why it was taped, so. How's that? Still good?
Yes.
Okay. If I put pressure into the calves, it's all right?
Yes.
There we go. And you just have to be mindful of the facility you work in, what they'll allow you to do, and what the clients are going to be comfortable with contextually in their culture. Back off slowly. Pretty quick and easy, right? It doesn't mean I won't still. Danielle Omo did a foot video with me. She came to the house.